Hello, and thank you for joining JCM On Demand today. I'm pleased to be joined by Andrew Flower, who's been practicing acupuncture and Chinese herbal medicine since 1992. Andrew is also a founding member of the White Crane Academy of Chinese Herbal Medicine and is passionate about the therapeutic potential of herbal medicine. Andrew completed his PhD and postdoctoral research at Southampton University. So Andrew, could you please tell us a bit about what you do?
Well, I'm a Chinese herbal practitioner and an acupuncturist. I've been practicing for almost 30 years now. I work in London, in a clinic in London, and I work near my home in East Sussex, just outside of Lewes. And I also, so I'm a practitioner. I also am the kind of principal of a herbal school, Chinese herbal medicine school called the White Crane Academy, and I'm a founder member of the Jade project, which is set up to help frontline workers suffering from COVID.
Wow, okay, thank you. And why did you and your colleagues set up the Jade Screen project?
Well, we set up the Jade Screen. Basically, we started in March when COVID was really kind of gathering momentum. And I remember kind of sitting and watching the news and seeing that, you know, a lot of healthcare workers were getting sick and were, you know, really having problems and were dying basically as a result of the coronavirus. And I was reading about how the coronavirus was being treated in China and how the earlier SARS epidemic in 2003 had been treated in Hong Kong. And I realized that they'd used Chinese herbs as a prophylaxis, to help to prevent infection there. So I kind of thought it would be a really good thing for us to do, to see if we could contribute to the helping to preserve the NHS and look after the NHS workers by offering some Chinese herbal prophylaxis, some herbs. And I spoke to various people. I spoke to a medic who wanted to work with me. And I also spoke to Jim Belcher of Balance Healthcare. And we managed to kind of work out the idea for a clinical trial that we approached St. Thomas's Hospital, where we would test Chinese herbal prophylaxis using herbal granules on 60 medics who wanted to be, or frontline workers, doctors and nurses who wanted to take part in the trial. Unfortunately, St. Thomas's decided that even though we didn't ask them for any resources, or in terms of money or in terms of management, they decided they didn't have the money or the management skills to help us develop this clinical trial. So they said no, thank you, which was a real shame. Because I really think we could have made a significant impact in their morbidity rates. So as a result of that, we decided, okay, look, we're not going to make any inroads into the conventional kind of medical domain. So we said, okay, let's set up our own project, our own independent project, where anyone who wants treatment, who's a frontline worker, can approach us, and we will provide them free healthcare. And in the free healthcare in these three areas: one, as a kind of herbal, as a preventative treatment to try and optimize their immune function, and to have some, you know, low-level antiviral herbs operating in their system, so that if they're exposed to the virus, they've got a better chance of actually resisting that kind of exposure. The second thing, for people who are in who have an acute COVID episode, so people who get COVID, often for the first week, they're kind of suffering and they're left to suffer, and they either get better at the end of that first week or they nosedive. And at the moment, conventional medicine doesn't really have anything to offer in that first week, whereas Chinese medicine does. And there's some reasonably, it's not particularly rigorous, but there's some research in China to suggest that, to support that. So we thought we could actually add something to give something to people in that first week to stop them from nosediving in the second week. And the third thing is, which is actually becoming more and more kind of prevalent now, is treating people with long COVID to help them to recover and help them to restore their health. So those are the three areas that we decided to set up in relation to the Jade Screen project. What a long answer.
Very interesting answer, and what a wonderful thing to decide to do as well. Could you just explain a little bit about the aims and objectives of the Jade Screen project?
Okay, so the Jade Screen project is set up for these three kind of areas of treatment. And what we basically said is it's a self-referral service for any kind of frontline workers. And when we say frontline workers, we're not just talking about NHS workers. We're talking about surgeons, we're talking about doctors, we're talking about nurses, we're talking about people working in the community in the NHS, but we're also talking about teachers, we're talking about bus drivers, train drivers, police people, carers, people working in care homes. Basically, what we said is that we will provide free herbal medicine for any of these people who want to look for preventative treatment or treatment of active disease or to help them recover from the illness. And that's the primary aim of the Jade Screen project. And we have a secondary aim as well, which is that we're both involved in teaching what we find, so the kind of the treatments that we find to be effective, we're sharing amongst our fellow professionals, and we have a kind of a slightly lofty ambition to do some clinical research, which we've started to do, but we're looking to get some funding to do some more rigorous randomized controlled trials.
Okay, and what has the Jade Screen project achieved so far, if those are the aims and objectives?
Well, we've treated, I think the latest in our books, we've had over 210 self-referrals, and most of those people have actually received treatment. We're in the process of trying to kind of audit, do a kind of service audit of what kind of results we're getting. We do a very simple kind of evaluation of how people are doing anecdotally, and we're collecting these anecdotes and doing kind of qualitative research on these. Anecdotally, we're getting some really good results. I would say, and I say this, obviously I have a bias, but I think I'm being fairly objective about this. I don't think there's anything else out there at the moment for long COVID symptoms that is as effective and consistently effective as Chinese medicine. People that we see who have been chronically ill for a long time, stuck on their sofas, not able to get out of bed, or not able to kind of walk for more than 100 meters or so, their health is being slowly restored by taking the herbs. Not a quick fix. Some people get better very quickly, but generally it takes a few months. But it's a consistent and really kind of interesting process. And as I said, I don't see anything else out there that is as effective as the Chinese herbs. So I'm really pleased and really excited that people we saw 3 months ago who were unable to get up and get moving, they're going back to work now.
That's very interesting. Thank you so much. Could you just talk about why it was important for you to do this?
It was important to me to do this for a number of reasons. One is I feel quite passionately that Chinese medicine has a major contribution to healthcare in the United Kingdom and in outside of China. I mean, I've been practicing for almost 30 years. I see roughly 40 patients a week. Whilst it's not a miracle cure, Chinese medicine, it is a really good system of medicine, particularly for kind of chronic illnesses that are not particularly well managed by Western medicine. So I've seen over the years how Chinese medicine can make this contribution. So at a time when the whole kind of nation was trying to come together and there was a real need for people to support the NHS and other frontline workers, I thought I really want to do my bit and I want to help and I want to use the skills that I've got. I'm better doing Chinese medicine than working at a food bank. So I thought this is what I want to do. And I'm really pleased and proud of the contribution that Chinese medicine has made. It's small scale, 200 people, but we might get up to 200 or 300 people by, in a few months' time. It's small scale, but those 200 people have really benefited from the treatment.
Absolutely. And I think you're right. This really has brought about a sense of community spirit, and anything anybody can do is massively helpful. So thank you for what you are doing.
Hi.
What's the current state of the Jade Screen project?
Well, the current state is what we did is we reviewed the data, we reviewed the evidence of what was going, particularly in China, and we developed some treatment guidelines, and then we basically trained about 30 or 40 herbalists in those treatment guidelines, so that we basically developed a network of herbal practitioners to operate as the core providers for the Jade Screen project. So now I would say there's been some kind of dropout. Some people are getting busy again in their own private practices and don't have time to spare. I would say the current state is now we've probably got about 20 practitioners who are working reasonably hard with the Jade Screen project. They are treating ongoing patients, both in prevention and in recovery from COVID. And we have raised approximately £20,000 to pay for the cost of the herbs. Everyone giving their time for the Jade Screen project is doing it free of charge. No one is making any money out of this. And the herb company, which is Balance Healthcare, that's provided the herbs, has given us a significant discount on the cost of the herb. So they're not making money, we're not making money. It's a genuine kind of goodwill kind of project. And at the moment, we're getting a steady stream. I think we're probably getting about a minimum of probably 10 new referrals, 15 new referrals a week. And I think there's no reason why we're not going to kind of carry on going. The only thing that might stop us is fatigue on our part. The other thing is that we are starting to kind of develop our research arm. So we've got about 10 qualitative interviews that we're analysing at the moment, and we are trying to submit an application for funding to do a randomised controlled trial, so we can get some, as I said, a more rigorous assessment of what the Chinese medicine is doing. But that's long term, tricky, and it's going to take a lot of time and energy.
Mm-hmm. It sounds like you're very, very busy and that you're doing a lot to help.
Yes, I'm very busy, yeah.
You were talking before about your views about Chinese medicine, how you think that it's a very well-structured and powerful form of healthcare. Do you know what the benefits are of Chinese medicine for coronavirus?
Yeah, I mean, in terms of coronavirus, see, to Western medicine, coronavirus is presented as a bit of a mystery. It seems to affect all kinds of different organ systems with weird symptoms that aren't really kind of present in a lot of the medical textbooks. Things like the muzzy head, the heavy limbs, the kind of mental fatigue, all these kind of the kind of co-appearance of things like palpitations, electric shocks going through the person's body, burning mouth syndrome. It's got these really kind of disparate symptoms that seem to affect people in all kinds of different ways at different times. So to Western medicine, it's difficult for them to make sense of it, but Chinese medicine really makes sense of it very well. There's almost 2,000 years of recorded history of epidemic diseases that occurred in China. And some of those, I'm damn sure, were coronaviruses. And so that they've got a way of understanding the illness that makes sense of the illness. And there's a whole kind of etiological and pathological description of disease it provides a good account for COVID. And on the basis of that, they've also developed all kinds of treatments that you can use. So various herbal formulae, key herbs that can be used that, for example, resolve dampness, that clear heat from the body, that help to strengthen the person's vitality and qi. And if you look at those things in terms of modern science, you find that actually there's kind of quite a good rationale for them. For example, there's a herb called hujang, which is a member of the Polygonaceae family. And hujang is a herb that we use a lot for an acute cough. It's good for a cough, it stops phlegm, it moves blood stagnation, and it clears phytoxin, which gives it an antiviral action. So sounds good in theory, and it works really well in practice. And when you look at the science of it, you find that it's got a compound called imodin in it. And imodin is used to block ACE2 receptor sites in the body. And ACE2 receptor sites are the way that the coronavirus enters into the cells, enters into the human cells. So by blocking those receptor sites, you block the virus. So although it's an ancient medicine and we're using it according to these kind of traditional principles to good effect, there's also some sound science that underpins what we're doing.
Mm-hmm, absolutely. So what do you think the future holds for Chinese medicine and COVID?
I think well, we're in the early days of the vaccine just being announced. I hope that the vaccine is effective and it works and that the pandemic is brought under control. And so that the need for kind of preventative treatment and acute treatments will no longer exist. But I think in this country, there's around, they estimate at least 60,000 people at the moment with long COVID. And at the moment, there's nothing that they're using conventionally that's going to help these people. And I think Chinese medicine's got a really important role in terms of helping to restore these people to good health and to help them to return to work and to their normal lives. So I think we have a lot to offer in that department. It depends to some extent on how open-minded conventional medics are or members of the public are and how we're able to get our word across. But I genuinely think that Chinese medicine could make a really significant contribution to helping to restore the health of these people who've contracted long COVID.
Mm-hmm, absolutely. And are you planning at all to do any research on this?
Well, I mentioned the research that we're planning to do is we're doing twofold. We're doing some qualitative research, which is relatively easy to do. So what we're doing is we're interviewing people who've completed or near completion of the course of treatment, and we're basically doing a thematic analysis of the kind of responses that they give. So that's kind of useful. It's anecdotal, but it's very rich data. So you get a real kind of idea of what the lived experience of the person who's actually been through the treatment. We're also collecting what they call MIMOP, which is a self-assessment outcomes measure that's been validated in general practice. And it's basically a way for patients to identify key symptoms that they think are important for them, and then to score on a 1 to 7 Likert scale how well they are doing and how severe those symptoms are. So we're collecting those MIMOP scores from the point of entry into the project to the end point of the project, and we're comparing the two. And what we're seeing so far is that there's some really nice changes. So people who scored, for example, 6 out of 6 in terms of severity for their symptoms, i.e. they're really severe, by the end of the project are reporting 0 or 1, i.e. that they're pretty insignificant by the end of the project. And we're getting that repeatedly again and again. We just need to be able to compile that and write that up and submit that to a journal, which will be peer reviewed. And then we can then take the next step, which is to do a more of a randomized control trial where we'll treat people with Chinese herbs and maybe compare it, for example, to a waiting list control. The big limitation is time and energy. I mean, I have no time. I'm working 7 days a week at the moment, so I need time to be able to enter the data that I've collected into this database that we've set up, and it's just proving to be really difficult to actually have to get the time to do that. But we will. It might take us a few weeks, but we'll do that, and then hopefully we'll get that paper and we'll take the next step.
It does sound like you're incredibly busy. Thank you so much for your time today, for fitting us in. I know how busy that you are, and thank you for everything that you are doing with Jade Screen Project as well. Thank you so much, Andrew.
Thank you very much. Thanks for asking the questions and for setting up the interview.
You're very welcome. Thank you.